So initially, when I started the focal cryo back maybe 4 or 5 years ago, we were doing a lot of saturation biopsies transrectally. Now we're moving more towards transperitoneal prostate biopsies. And this is kind of a schema of how we do the biopsies. So we use the cryo or brachy grid so that we can really map out the exact location of the cores. And each core will be sent to pathology in its own formalin container label with a specific location. But we really biopsy, half of the biopsies will come from the base of the prostate, and half will come from the apex of the prostate. And what we do with each biopsy is we label the distal margin of each biopsy. So if you can see here on this schematic, is that on the left-hand side we have a more biopsy directed more towards the base. If you can see below that, we end up inking the distal margin so that the pathologist will be able to tell us specifically where in this core the positive area is. And we do the same thing with the apex. Typically, I'll do a 40-core saturation biopsy, but that really depends on the size of the glands. I've had some glands smaller than this 30 grams, and we have only done maybe a 30-core biopsy, or we've had some a little bit larger, and we've done a 50-core biopsy. But on average, we do a 40-core prostate biopsy. So next slide, please. So we did a saturation biopsy on this gentleman a month ago, and this is showing you exactly where the location of the biopsies, positive biopsies were. So on the right side, we had 4 cores that were positive, and on the left side, we had 2 cores that were positive. Again, we send each core to pathology in its own formalin container, and again, the distal edge of each core is marked with ink.